So, regenerative treatment for restoring hairline or for hair loss is an umbrella term. It covers new and exciting treatments, including the use of stem cell based treatments for helping hair to boost hair growth and hair density. So, there are regenerative treatments. So, treatments that help to regenerate tissue. And in this case, we're talking about hair along the hairline, or anywhere else on your scalp if you wish. So they may be terms you're familiar with, like platelet-rich plasma, PRP, but also newer terms, perhaps, like adipose stem cell-based treatments. So what I love about this is the possibility of taking tissue from your own self, finding what is essential for hair regrowth or hair density boosting, and reintroducing it back to that patient. So there's a wide range of things we can use. Most importantly, it needs to be tailored to the individual patient and to the situation, the hair loss situation. So there's quite a lot. And as mentioned before, they're terms that most of us would have come across, be it like exosomes, stem cells, PRP. Really, it's important that we understand what the terms mean. So PRP, for example, is based on concentration of platelets, typically obtained from that individual and concentrated and reintroduced to an area that one wants to repair. So so for hair loss, you find that actually it helps to improve hair density, but the results are individual. Similarly, when we derive growth factors from adipose tissue, so fat tissue to you and I, so when you derive growth factors from there, again, the results are individual, but that, I believe, has more promising results compared to PRP alone. So at the risk of naming particular companies, we're really looking at harvesting tissue that's rich in stem cells, and harvesting the product from those cells to help stimulate hair regrowth or hair density, be it on the scalp or in an area of concern. There's so many things that what we always say for our patients is that you come in, you get a consultation, we find out what's most important for you. And I personally like to choose things derived from that individual person. So the term exosomes is used so freely that people think the exosome is the treatment. But in the end, exosomes are just a vehicle that carry the juice, the thing that you want to grow hair. And derived properly, derived from that individual, concentrated appropriately, you can see some good results, or promising results, I should say. The results we're seeing are promising. So, but I would say really the results are individual. What we find is people report an improvement in their hair density, a reduction in hair fall. And to be honest, when you combine those two things, you reduce the number you're losing, preserve the number that's already there. Overall, that'll give you an improvement in the appearance of your hair. So I would say the results are individual, but absolutely promising. So the potential side effects, or the risk, it depends on the source of the regenerative treatment. So if it's autologous, so obtained from that individual, the risk of, say, an allergic reaction is reduced. You can, however, have products that mimic what your body produces, the growth factor that your body would naturally produce. So if you've got an exogenous source being introduced to someone, there's a risk of an allergy. So a small test is recommended beforehand. So side effects, most of them at the moment, we introduce them by using a small needle, a small injection. And so the discomfort that would go with that is probably the one thing I'd mention. And for my patients who are needle phobic, we use a special delivery system. Now, you may ask me, why don't we do it for everybody? It's because actually I do believe in the power of microneedling as well. So typically these treatments are combined with microneedling to optimize the results that you get. Okay, so in general, the first thing people may notice will be a reduction in hair loss. Next, people comment about improved density. Most things are not used on their own, so we use a combination of treatments tailored to that individual. So I go back to my usual thing. Correct the correctables, identify what's going on for that individual, i.e., the cause of your hair loss. Once we identify that, then we make a tailored individual plan for you to including be it medication if required or using one of the many promising regenerative treatments to improve the condition and density of your hair. So first, so within a few weeks, you may notice a reduction of hair loss, but typically with most things to do with hair, you're waiting quite a few months to see the final report.